The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We're here on our episode today with Carrie Fox, a NICU nurse who is going to help us release all of our fears about the potential visitation of our baby going to the NICU.
Carrie Fox is a registered nurse who spends her day, actually night, working with babies in the NICU. When she's not working in the NICU, Carrie enjoys photography, spending time with friends and family, and traveling the world. Well, such good things.
All the good things.
Yes. So give us an overview. What's it like in the NICU? What does your day-to-day, night-to-night look like?
Okay. Well, first, little plug for the NICU. I think it's the best place in the whole hospital. The babies are the cutest. Everyone's so nice. So I would say, first off, don't be too scared. Everyone's really nice there.
Really?
Basically, we get all kinds of babies. We get preterm babies, we get full-term babies, we get babies who are born outside of the hospital. We get all the babies for a whole host of reasons. So it just, kind of depends on your baby and what's going on, but we will take them all.
And if we're a first timer and we don't even know what NICU stands for, can you tell us?
Neonatal Intensive Care Unit.
Okay, so these are babies who need intensive care.
Yes, like more than just a typical well baby. So yeah, we have, like I said, a whole host. We have tiny 1-pound babies all the way to big, fat, chunky 12-pound babies. They're kind of all over the gamut.
And does this look like giving them extra vital checks, giving them extra love? It's probably case by case, but
it's case by case for sure. I would say probably the biggest reason why we see babies is respiratory distress. So they're having a hard time breathing. Whether that's because they're just like super early and their lungs aren't developed. Sometimes, here's the thing. We ask babies to do a lot of work when they're first born. They go from a nice, comfy environment where everything is being taken care of for them. And we're like, and you're cut off. You have to breathe on your own. You have to regulate your temperature. You have to do so many things. And for the most part, most babies kick into gear pretty quickly and it's totally fine. But a lot of times, sometimes babies just need a little extra help to get there.
And we're so grateful for nurses like you who can provide that care. Someone who's experienced, who really cares for these babies and is going to treat them just like you would your own little baby. And you probably have way more skill than we do too, because
I don't know about that, but
as a first-time mom, you've probably never had 100% care for another little baby.
Yeah.
And so because this is what you do night and day, you have seen a lot of the reasons that they're coming into the NICU and how to help them. So respiratory distress.
Probably our number one reason.
Number one reason that they're there.
Just can't breathe.
Is there anything that we can do while we're pregnant or while we're delivering so that there's a difference in how they are able to breathe when they're born?
Maybe not necessarily breathing wise, but I would say the biggest thing is prenatal care before, while you're pregnant, is making sure that you are getting prenatal care. Because a lot of times, if a baby has any kind of a heart defect or something like that along those lines, you can detect that early and you can be prepared. There's nothing that's a bigger bummer than when you go in and you think everything's going to be totally fine and you end up with something really scary. I think that the best way to prepare is to just be informed and educated as much as possible.
And there's a few ultrasounds that will take place during your prenatal care. Is that usually where they are finding an abnormality?
Typically, especially the 20-week scan, they do head to toe. They look at all the different systems in baby. And that a lot of times will pick up any serious abnormalities. I know that's the one usually that women get a little nervous for. But yeah, if they can detect it early on, you can come in with a plan. If you have no idea, you're walking in blind. So, I think just prenatal care and being as educated as possible is probably the biggest thing.
Have you found that when a mother is diligent during her pregnancy, right, she's taking in the vitamins, she's not intaking things that could be dangerous to her or her baby, that you have better health outcomes for our babies?
Exactly. I mean, I think anything preventative you can do is always going to end up, it's always going to get you to a better spot than you would have been otherwise. And like I said, if you know things are coming, then you can prepare for it. So,
And then, of course, there's the you prepare and then you still are surprised.
yes, 100%. We get lots of surprises.
For sure. I remember with my third pregnancy, there were a lot of complications for me personally, and we were focused a lot on me. And then when the baby was born, he didn't breathe right away and was whisked off to the NICU, and I was not expecting that. So I was definitely caught off guard because more of the attention was on me as the mother. So yeah, the balance there and trying to prepare, but then being aware that things can come up as well.
Totally. I feel like the NICU is one of those things that people just don't ever, like, especially with a normal, healthy pregnancy, you do not see that your baby is going to get whisked away to the NICU. And so we do, but a lot of times we really do get babies that are full term that should be totally fine. And they really just need like a few hours of CPAP and then they're fine, you know? So.
And is that mainly detected by their APGAR score when they're born?
Yeah. So definitely APGARs. I feel like most of the time when a baby comes out, it's pretty clear, like things are going good or things are not going good. And there are a lot of things that they like, if you have meconium stained fluid, if comes on SSRIs, if, you know, like things like that, that they'll have us kind of on standby just because we know that sometimes those can really contribute to a baby not doing super well outside of.
And what are some of the basic things we're looking for right when a baby's born?
Tone, color, like how they're breathing. Are they crying? Like, are they actively participating in life? Are they like, yeah, no, I'm good. I want to go back inside my mom. You know, so we're looking at all of the basics of APGAR scoring. We're looking at all of how the baby's doing. A lot of times a baby will come out and they look okay, but you'll sit and watch them and they'll be like grunting and they're like obviously working really hard to breathe. That's definitely a reason why we would take them back to the NICU.
So you mentioned the CPAP machine, and that's what my baby was on just for a few hours, and he was okay. What are some other interventions or things that they do to support the baby right when he gets to the NICU?
So when you get to the NICU, we're going to do a whole assessment, head to toe. We're going to weigh the baby. We're going to take all the measurements. We're going to do all the things. So, and it's so funny because we get the comment so often, we're a very well-oiled machine. Like we get back there, we know what we're doing. We're getting it done because time is of the essence. So all of the labor and delivery rooms are equipped to do CPAP. But we don't stay there. Like if the baby is not responding super well within a few minutes, we're going back to the NICU. So we'll just do like a whole baseline assessment. And then typically we put them on CPAP and we let them hang out for an hour or two. We'll try them off of CPAP, see how they do. Sometimes babies just need like an hour of CPAP. Sometimes they need like 5 or 6 hours of CPAP. Sometimes they need days of CPAP.
And is that just a little oxygen mask that goes over their nose and mouth?
And it like recruits the lungs. So it's going to open up those, we call them alveoli. It's like the little lungs that just pops them open. Some babies just need a little extra help getting there. So yeah. So it just kind of depends on the baby. We watch them. We just go by their cues. We like to think we're in charge as adults, but we're for sure not in charge.
Yeah, these little guys, they're the ones that are in charge.
They know. So,
well, what about feeding in the NICU? So here you have a new baby. Maybe they're, a premature. Maybe they are full term. And we have the option of requesting formula or breast milk or trying to nurse ourselves. Like, what does that look like as far as feeding these little guys?
Yeah, definitely. That's a great question. I think a lot of it depends on what kind of respiratory support they're on. If they're on CPAP, it's not safe for us to be trying to like breastfeed or bottle feed because of the risk for aspiration. So typically we call it an OG. It's an orogastric tube. It goes into their mouth and down to their stomach. It's kind of a dual purpose. It basically kind of helps burp the baby, helps all that air that we're pushing down into their lungs and their stomach to come out. But then also we can feed through it. So that is definitely an option. Typically, if we have a baby that's not going to come off of CPAP or is just going to stay with us for more than 6 hours-ish, we typically don't feed them for the first day. We'll put an IV in them. We'll keep them hydrated. I mean, if you think about breastfeeding a baby, the first day or two, you're not really getting hardly anything, like maybe a few milliliters. So they just don't need a ton. So we keep them hydrated, IV fluids, and give them a day. We don't bombard them in their tiny little stomach all at once. Typically after the first day, if they're still on CPAP or any other kind of higher respiratory support, we have a feeding protocol. So we start them like nice, low and slow. We don't like just shove a bunch of milk down their tummies, and just kind of progress up. And then as we do that, we wean the IV. So we kind of get to a point where we meet in the middle and we turn off the IV, and then they're only getting milk. So yeah, so we definitely have protocols. Once they're off of CPAP or like a high flow nasal cannula, if they're on 2 liters or less of oxygen, then we can work on breastfeeding, we can work on bottle feeding, whatever the preference of the mom is. So yeah. And as far as like options feeding wise, obviously we will take any and all colostrum we can get from mom. We also have, we call it PHM. It's pasteurized human milk. It's donated breast milk. So that's typically what we do use for the first couple of weeks, especially while mom's supply is coming in. We might be feeding the baby more than the mom's getting. We supplement with that PHM. If the mom's preference is that we use formula, we will totally honor that and use formula. So it just kind of depends.
And are you in need of donated breast milk?
Always and forever.
All right. Did you hear that, ladies?
If you have an oversupply, please donate. It really does help these babies so much, especially our teeny tiny ones. So
where can we go to start the milk donation process?
The company that we use is called Mountain West Milk Bank. They are fantastic. They do such a good job, and they supply us with so much breast milk. So I would say that they're a great resource for you guys to look at.
That's great.
You'll go through like a screening process, and then you can donate to your heart's content.
I was able to donate with our first baby, and always just felt so excited that I was able to give back a little something to the moms who needed it. And it was a really easy process. There was a screening and a blood draw.
Mm-hmm.
And then I was just able to drop off the milk at the same facility where my sons were going for their pediatric care.
Yeah.
So it was really easy. I was just able to take my frozen milk, and they actually provided those milk bags as well. So it had like very little cost to me to pump and store it in the freezer and then take and donate it.
So helpful too. We are so appreciative of all the many gallons of breast milk we get.
Well, with feeding not as important those first little bits, what do visiting hours look like, and how often are mothers able to visit their NICU babies, and with other family members wanting to come and see?
So it's going to vary, I think, probably hospital to hospital. At our hospital, we usually have a 6-hour, we call it a transition period. So right after baby's born, say the baby is just on CPAP, we bring them back. We usually give them 6 hours to try and wean them off of the CPAP so that they can go back to mom. If we hit that 6-hour mark and it's just clear, like, we're just going to need some more support, then we actually, like, they're officially admitted. So once they're in that transition period, they can go back to mom. No questions asked if they're fine. Once they're fully admitted, it becomes a little bit of a different ballgame. During the transition period, we typically only have like your significant other, whoever is there with you, whether it's father, another mom, whoever's there is your support person, is the person going kind of back and forth between mom and baby. Once the baby is officially admitted, we don't have visiting hours. 24 hours a day, 7 days a week, you can come anytime. We do have moms that literally come at 3 in the morning, especially when they're like, it's still in the hospital recovering. They'll just kind of come in and out.
Oh.
Yeah, we are very, very welcoming, and we want you to be involved with care of your baby, whether that's 3 p.m. or 3 a.m. Whenever you feel the need to be close to your baby, we want you to have access to your baby. At our specific hospital right now, our visitor policy is you can have up to 4 people up at the bedside. Like I said, 24 hours a day. The visiting hours are not just specific to mom and dad. Sometimes that changes with RSV season, obviously, when infections are rampant. We kind of clamp down a little bit. But right now, it's 4 people at the bedside.
And are there places to sit, places to sleep?
Yeah. So we have like a parent lounge, especially when you have like family members who are switching out and want to come see baby, and they can hang out in the parent lounge. We do have sleep rooms that are available. They are typically reserved for people who are either getting ready to go home or who live significantly far away. Our hospital also has a guest house that is kind of a first come, first served basis, but they're like little tiny apartments.
Or to a hotel? Like, are you
Yeah.
paying on a nightly basis?
Yes, but it's a significantly discounted rate. I feel like it's only like $20 or $30 a night. So if you can't afford that, the hospital will step in and help you. And those are typically reserved for people who live far away because we get transports, from Wyoming, Las Vegas, like all over the place. So if you live 4, 5, 6 hours away, like it is not feasible for you to be going back and forth.
So is there not a NICU in every hospital, or what's the reason
No,
for?
not.
Okay.
And we have different levels 1 through 4. Like a level 1, 2, they're going to have maybe some CPAP, but like anything less than that, they'll take. Our NICU is a level 3. So we take pretty much everything except for like really rare heart stuff that goes up to primary children. So we don't have like babies on ECMO or anything, but we do surgery babies. We do, any type of like intubated babies. So yeah. So it just kind of depends on what the level of care.
And when you're looking for a provider, is it pretty easy to tell if that hospital will also have, a certain level of NICU? Is that just kind of like found on their websites?
Yeah. And you can just Google like the NICUs here in the state of Utah and figure out what level they are. I think that we have several level 3 NICUs kind of spread across the state. Like I said, the only level 4 NICU that I'm aware of is Primary Children's up in Salt Lake. But usually, unless your child has a super rare heart defect or something like really, really, really crazy, level 3 would be great. And they should be able to take care of your baby.
Good to know. And then once they've had that NICU stay, are there effects afterwards, or it probably depends,
I'd
but
say it's so case by case. Every year we have a NICU reunion where all of the babies that we've taken care of over the years come, and it's so cool to see. And you will see 23-weekers who were a pound who are doing so well. And you can see the opposite where you have like full-term kids who have some long-term effects. So it really is super individual. It's kind of wild.
And since this is a hard time for parents, what kind of support groups or resources are provided for them?
So yeah, I think probably the number one thing that our hospital does is they have a parent support group that meets every week. They're so awesome. They're made up of parents and volunteers who have had NICU babies, as well as some employees who have had NICU babies. And so it is a really good place to, vent your frustrations, but also to talk to people who understand, because I think, especially for parents who have babies in the NICU for a long time, it is a very unique experience. Like it is something that nobody else is going to understand except somebody who's been through it. So I think that that's such an awesome thing that they do. They will walk around every Tuesday night and they like hand out little gifts to all the parents, and they provide a dinner, and it's just like a really good, safe place to talk about like what's going on with your baby and, what you're thinking and how you're feeling. So I think that that's been awesome. So
we love to share resources on the podcast, and there's so many books that are really helpful. In the What to Expect When You're Expecting book, she says, caring for a premature baby can be emotionally taxing, and it's important for parents to seek support. Preemie development may follow a different timeline compared to full-term babies, and milestones may be reached later, but each step forward is a significant achievement.
Absolutely. I think that's another good point you bring up, is that development can be a little bit different. So say you have a baby that's born 2 months early, 8 weeks early. They are going to be looking at that baby's development 8 weeks later than their birth date. So when they're hitting their 6-month milestones, they might actually be 8 months old or 9 months old. But developmentally speaking, we don't expect them to catch up until more close to their due date. So, yeah.
Yeah. Well, this has been such a great conversation, just in giving peace of mind and an overview into the NICU. Every week we like to share a Mom Squad secret, so we'll end with that. This one is by Ashley, and she says, during labor, do deep breathing. Fill your belly and lungs, and then let it all out until you have no more air. Then start again. And as we've been talking about air for the babies and air for the moms, we can do that deep breathing anytime, and that will bring support.
I love it.
Carrie, this has been such a privilege to be able to talk to you today. Is there anything else that you want to share to our listeners?
Don't be too scared of the NICU. Everyone will explain everything, and we will take good care of your baby. We love our babies.
They're in good hands. I love how you said it's a well-oiled machine. You know what you're doing. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.